ahead. And we're here to talk about a new way to move our state forward economically while we're beating the pandemic. We know the very first case, of course, was in Washington State. That was just short of a year ago today. We've all been clearing a path forward during these difficult days. We know that we are not where we want to be today. We remain concerned about the general status of the pandemic, and obviously we have new concerns regarding the new mutant strain, which appears to be more transmissible, that gives us added concerns. The current level of activity remains, unfortunately, very aggressive, and I am glad that Washingtonians are all banding together against this pandemic. No one has been left untouched by the forces of this pandemic, and many of us continue to suffer in many ways. So we are not out of the woods yet, but we do want to provide a path forward for economic recovery in our state. So today, to that end, we are announcing a new plan, we call it Healthy Washington, to move forward in 2021 once we see COVID activity reduced, once we see hospitals that are not overrun with COVID patients, once we see continuation of our efforts to wear masks to prevent the spread of this disease, and once we know that we're taking the measurable steps that are needed to beat this pandemic. So what we announced today will not be resulting in big, significant reopenings today, but it is a plan so we can do that tomorrow when these conditions exist to allow us to move forward. This plan will go into effect on January 11th. It includes a small resumption of activity statewide. This includes live entertainment with very tight restrictions. We're talking about ticketing groups of 10, as well as certain fitness programs. There are some important differences I just want to highlight at the beginning between this roadmap and previous Safe Start programs. Right now, we only have 2 phases, but more phases will be put on the board when it becomes clear that we have knocked down COVID activity emphatically. And also a significant difference is that this will not be done on a county-by-county basis, but instead it will be done by regions. We have found that because healthcare systems are regional, and we know that viruses do not respect county boundaries, we're moving to a regional assessment of criteria to allow increased economic activity. This makes sense not only from a public health perspective, but also from a healthcare delivery perspective. And on the screen here, you have a map of the regions. We have 8 regions. They're both based on health system resources over the geographic area. So their combined health metrics, we know, play an enormous role on what we use to track our progress. These are metrics that our partners are already familiar with that we will be using to judge when we're ready to reopen certain economic parts of our state. These are COVID-19 hospitalization rates, ICU capacity, case data, and test positivity data. All 4 targets will need to be met for the regions to reopen. And based on the metrics this plan is built on, every region in phase 1 today, every region will start in phase 1 today, given their metrics at the moment. There won't have to be any application process to move through to phase 2. It'll essentially be automatic, if you will, based on information regularly collected by the State Department of Health. So it'll be something that the numbers will tell the tale. So if I can go through these briefly, Lacey will have more description here in a few moments. So to advance a phase, a region will need to show that it has had a 10% decrease trend over the last 14 days. Also that it has a 10% decrease in COVID hospital admission rates over the same period, that the ICU occupancy rate is less than 90%, and that the test positivity rate is less than 10%. When a region moves to phase 2, restaurants may reopen with 25% capacity as well as indoor fitness centers. In phase 2, sports competitions may resume with limited spectators, and wedding and funeral ceremonies can increase their capacities from current limits. And you can find what phase your region is in and how it's progressing on the website. We would now like to have some comments from Dr. Shaw, who has been grabbing this opportunity and challenge with great energy, and I'm appreciative of him jumping in here and helping us with this effort. Dr. Shaw.